There we go. Okay, so I'd like to welcome everyone today to this free webinar covering healthcare access for LGBTQIA2S+, where we have Dr. Melanie Morrill, who's going to discuss some barriers and opportunities that exist within the practice. So I'll start with a land acknowledgement, acknowledging that we're on here at MacEwan, we're on Treaty 6 territory, and then we honor the language, history, and ceremonies of the First Nation and Métis Inuit who call this territory home. You can flip to the next one, Melanie. So just a few housekeeping rules. You don't need to worry about your microphone and video now because we have it automatically turned off at the moment. We'll be taking questions at the end. But if you have questions during the course of the presentation, please feel free to throw them in the chat. And if it's relevant to discuss during the presentation, we can turn your mic on and turn your video on if you'd like to, share a comment during the presentation, or just, we can address the question through the chat. And also, as I mentioned, sessions are being recorded, so we'll send out a copy of this to everyone after. So moving on, excited to have Dr. Melanie Morrill with us. She's a doctor of acupuncture and clinic director and small business owner of Accessible Acupuncture. And so with that, I'll hand it over to Melanie, and I hope everyone enjoys this presentation.
Thank you so much, Sean. As Sean mentioned, I'm a doctor of acupuncture and I own my own small clinic. It's called Accessible Acupuncture, and we're located right here in Edmonton inside the High Center. And I have a focus on accessible and inclusive care. Today, we're going to be covering a whole bunch of different topics, but we're very briefly going to cover who are the LGBTQIA2S+ community, what are barriers to healthcare, what are barriers specific to the LGBTQIA2S+ community, what can individuals do to reduce barriers, be allies, and get the care they need, what can healthcare providers do, and what can clinic directors and small business owners do, and what does the LGBTQ+ community do to advocate for themselves? So very briefly, most of us will be familiar with the LGBTQ in the LGBTQ+2S+ and SOGI communities. So I've listed out what it all stands for. Most people are not familiar with SOGI. SOGI is sexual orientation, gender identity, and expression. Everyone has a sexual orientation, gender identity, and expression. And for some people, they're all exactly the same thing. And for some people, they're very different. The idea behind SOGI is to have a more inclusive acronym without adding more and more letters and words to it. They can generally be used interchangeably, but I'm going to stick with LGBTQIA2S+ because more people are familiar with it. And an important part of language is understanding. What are barriers to healthcare? Barriers to healthcare is anything that restricts the use of healthcare services by making it more difficult for individuals to access, use, or benefit from care. These can be broken down into individual barriers, which are things that individuals often have control over, and systemic barriers, which individuals do not have control over. Individual barriers to healthcare are things like not having transportation to medical appointments. Everything is there. The doctor is there, you're available, but unfortunately, you just don't have the transportation to get there. So you're not able to access care. Unaffordable medications and recommendations. You may have been able to get to the appointment. You may have been able to speak with the doctor and you put together a great treatment plan. But if you can't afford the medications and recommendations, you're not going to benefit from the healthcare you've received. And another big one for working professionals is unable to get time off work. Lots of jobs are 9 to 5 and lots of doctors' offices are open from 10 until 3. Unfortunately, sometimes these just don't line up and you have to go to a walk-in clinic and you're not able to see your regular family doctor. Contrast this with systemic barriers. Systemic barriers are things people and individuals just don't have control over. So these are things like doctors not accepting new patients. There might be a healthcare clinic, but unfortunately it's full. So the doctor is just not accepting new patients. This often goes hand in hand with a shortage of doctors and healthcare providers, which is something we're seeing a lot right now here in Edmonton and Alberta. Long wait lists to see specialists. Again, we're seeing a lot of this right now, particularly in oncology. There are some people who are diagnosed with cancer and they're being told they're going to be waiting between 6 months and 2 years before they're going to be able to see an oncologist to get their cancer treated. Another one is healthcare provider stigma and bias, and we'll definitely be diving more into this one, and language barriers. The easy language barrier that comes to mind is when people don't speak the same first language as their doctor. So for example, if someone is deaf and their first language is American Sign Language, they're going to have a challenging time finding a doctor who's fluent in American Sign Language. Now we have ways around barriers like this, like translators or using the written word, but it is still a barrier to healthcare, which makes it harder for people to get the care they need. There are barriers specifically to LGBTQIA2S plus healthcare. The most common is hesitation to seek medical care, usually due to a fear of bias, stigma, harassment, dismissal, and unsupportive healthcare providers. This is a well-founded hesitation, and it's been well documented that healthcare providers often have bias and stigma. They treat LGBTQ plus patients with dismissal and harassment, and sometimes they just don't know how to take care of them, which is really unfortunate and really frustrating. And it's one of the things that we're going to address in our talk today. Another big one is being unable to travel for healthcare. Even though we have universal healthcare and visiting a doctor is covered, not all procedures and doctors are available here in Edmonton. There are several surgeries that are only available in Montreal and Toronto. The surgery itself is paid for by Alberta Healthcare, but the flight to the surgery is not. Lodgings while you're at the surgery is not. And any additional needs you have around that, like getting a dog sitter or childcare, those are not covered at all. And it's inconvenient to have to fly to another province to receive essential healthcare. Now, those were some of the individual barriers, but there are a lot of systemic barriers. And one of the most common is doctors not accepting LGBTQ plus patients due to stigma and bias. I work with a fair number of LGBTQ plus folks, and I've heard from one particular patient how challenging it was to find a family doctor who was willing to take them on as a patient and help them get the care they needed. They had seen 4 different family doctors in the greater Edmonton area to try to find someone who would care for them. And 3 of those doctors simply said, I don't know how to do that. I don't think I'm the best person for you. I think you should just keep looking for a new family doctor. Doctors are well within their rights to say that this is not something that they can treat, but they're required to give you a referral to someone who can. Unfortunately, because this is not well known, it's not spoken about often, it's really hard to find a healthcare provider who does accept LGBTQ plus patients. I know of 2 family doctors in the Edmonton area who do a fantastic job with LGBTQ plus healthcare, and right now they both have a 6-month wait list. Another big barrier is around language. When we use pronouns, sex, and gender, we need to use them accurately in medical notes and charts, but we also need to use them accurately when talking to people. And another part of that is dead naming in healthcare. Unfortunately, dead names need to go on healthcare records because they're usually a person's legal name, but there's no reason at all to use it in conversation with that patient. And it's important for healthcare providers to remember that. And the other big one I've already touched upon is providers who don't know how to get supports for LGBTQ plus specific medical needs. If someone's looking for a voluntary bilateral mastectomy, not every family doctor is going to know how to start that process. The other really big one is when healthcare providers aren't aware of healthcare disparities and they're not aware of differences in treatment protocols. The differences in treatment protocols is very important to me because this often comes up in fertility. I see a fair number of fertility patients, and I wanted to just briefly talk to you about one of my patients. Her name was Jessie, and she was looking to become pregnant. Her and her wife were ready to start a family, so they went to a fertility clinic. At the fertility clinic, they were told, we can do IUI, which is intrauterine insemination, or we can do IVF, which is in vitro fertilization. The cost is significantly different for these two procedures. So they said, you're not diagnosed with any infertility, might as well start with IUI, and we'll see how it goes. After 3 rounds of IUI, they were recommended to start trying IVF. The reproductive endocrinologist didn't explain to Jessie why they had made that recommendation. They made the recommendation because that's the standard for heterosexual couples who've been trying and have been diagnosed with infertility. For lesbian couples who've not been diagnosed with infertility, the recommendation is actually to use 6 rounds of IUI before starting IVF. As you can see up on the screen, this is a huge cost difference. Jessie spoke to me about the change in plan, and I asked her if there's any particular reason they were going to IVF. And she said, no, the doctor just recommended it. And I asked Jessie to double check with her reproductive endocrinologist that the doctor knew that she was a lesbian and she was seeking IUI to become pregnant without being diagnosed with infertility. She went back to her reproductive endocrinologist and reminded them, hey, by the way, I'm a lesbian. I haven't had intercourse to get pregnant. And her doctor went, oh, okay, in that case, you can have 6 rounds of IUI before we move to IVF. On Jessie's 4th round of IUI, she became pregnant. Reminding her doctor that she was a lesbian saved her between $13,000 and $20,000. Being LGBTQ+ is expensive, but it shouldn't be $20,000 expensive. And unfortunately, it being more expensive is not the worst part of all of this. Healthcare disparities are. So consequences for most of these barriers to healthcare are additional wait times and frustrations like that. But the big problem with all of these are the healthcare disparities. Healthcare disparities are preventable differences in disease in disadvantaged populations. There's 6 major health disparities for LGBTQIA2S+ folks, and those are listed here. Things like heart disease should not be worse if you're gay, lesbian, or LGBTQ+. Heart disease is heart disease. All of our hearts love, and all of our hearts look the same. The barriers in healthcare we talked about earlier are what are contributing to these healthcare disparities. So what can we do about it? We need to move this needle from here, where we're slightly being inclusive, to being all the way inclusive. The more inclusion we have in healthcare, the less disparities we have. In my experience, most healthcare providers are non-discriminatory, which means they're not doing anything to be inclusive, but they're not doing anything to be exclusive. We need to do better. We need to be inclusive, and we need to make sure that everyone is able to access the healthcare they want. I have found that when I talk to other doctors, most people are curious. Most people want to learn, but not everyone realizes why this is so important. One of the big questions I get is, aren't the LGBTQIA2S+ community a small minority? Do we need to cater to a small minority or make big accommodations for just a few folks? And you know what? 15% of Gen Z identifies as LGBTQIA2S+. That is not a small minority. To compare and contrast, 10% of the population has diabetes. If you went to a family doctor, with diabetes and you said, hey, I'm here for diabetic treatment, and they said, I'm so sorry, we don't know how to treat diabetes here. That's not something our doctor's familiar with. You're going to have to find someone else. We would all be shocked and horrified because everybody should know how to treat diabetes. Just like everybody should know how to care for LGBTQ+ folks. And while I recognize 15% of Gen Z is less than 10% of the entire population, the general trend is that as generations go on, more and more folks identify as LGBTQIA2S+. And all of that aside, Canadian healthcare is universal. We need to make it universal. So what can we do to be inclusive? Everyone has a role to play in inclusion. Individuals, healthcare providers, and clinical directors and small business owners. So what can individuals do to be more inclusive? Always ask someone their name and call them by their name. We all know a William who goes by Bill, and we all know how rude it is to refer to Bill as William. He has said his name is Bill. Everybody calls him Bill. Always ask someone their names and pronouns and apologize when you make mistakes. When we're learning things, mistakes are going to happen, and the way we apologize for those mistakes is important. Avoid using offensive and outdated language. Language is always changing, and it's important to use modern language so that we understand each other. When seeking healthcare, tell your healthcare provider your sexual orientation, gender identity, and expression if it's relevant and you feel comfortable doing so. If it's not relevant or you don't feel comfortable doing so, don't worry about it. Now, what does all that look like in the real world? So, hello, my name's Melanie. My pronouns are she and her. What's your name? What pronouns do you use? Simple, easy breezy. And while we're at it, we can make more inclusive language choices. One thing with inclusive language choices is this generally applies in group settings or when we don't know. So for example, if I'm talking to a group of couples, I may say you and your spouse because I want to include everyone in the group. If I'm talking about my friend Lindsay and her husband, I'm going to say Lindsay and her husband. It's also really important that when we're using language, if someone else uses a particular word choice, mirror that back to them. So if Lindsay says her and her husband, I'm going to say that too. Chest feeding instead of breastfeeding. So in a group setting, here are some techniques for chest and breastfeeding. If I'm talking to a particular woman who chooses to breastfeed, that's the word choice I'll use. I've listed a couple other ones here, but a personal favorite of mine is always going to be to refer to a fetus or baby of unknown sex as they, them. I don't know why it's so common to refer to babies and fetuses as it, but my preference is to use they, them. And I find once you talk to folks about it, everyone likes to use they, them. That being said, if a pregnant person refers to their baby as it, you do too. Now, what about when we make mistakes? Mistakes are absolutely going to happen. Apologize for your mistake. I'm sorry. I said she when I meant to say they. Keep practicing. Use humility and try harder next time. It is genuinely important to use someone's pronouns. So do your best, give yourself a little bit of grace, and be kind about it. When you make mistakes, acknowledge, and then move on. What can healthcare providers do to be more inclusive? I'm talking specifically about healthcare providers in a healthcare setting where this particular healthcare provider isn't able to change everything in the clinic. They're only able to focus on their own behavior. They can ask about gender, sex, legal name, pronouns, name, and do so with open-ended questions. So for example, how should I look you up in the system? If their legal name is required to be on the chart, it has to be there, but make sure that their preferred name is there as well and use their name when talking to them. Don't make assumptions about people's SOGI Ask them if it's relevant to the healthcare service they're receiving. And if it's not relevant, don't ask personal and intrusive questions. If it's not related to care, don't worry about it. It's none of your business. Offer additional screening tools around healthcare disparities that affect LGBTQ+S populations. If you know that someone is a member of the LGBTQ+ population and you're concerned about something, offer an additional screening tool. These are things like screening tools for eating disorders, mental health concerns, heart disease, and so on and so forth. If you're able to wear a rainbow pin to have a visual signal that you are a safer person to talk to and you're comfortable doing so, absolutely do that. And I dove into this already just a little bit, but what does it look like in real life and in a clinic? Hello, welcome to Accessible Acupuncture. Can I get your name for your check-in? Instead of assuming who is coming in, because it's possible that their name in the system is not their name. It's not their preferred name. When a patient shares something with you that you don't fully understand, can you share a little bit more about that so I can fully understand? Leave it open-ended, let them share what they're comfortable with, and leave it at that. Thanks for telling me. Everything we discussed is confidential. Is there anything else I should know? And one of the most important ones that I mentioned before is to reflect the patient's language. If they say they, them, you do too. And another way to learn more, because being an ally is an ever-evolving journey. We are always learning how to be the best allies we can be. Take continuing education in LGBTQIA2S+. Almost every healthcare provider is required to take some form of continuing education, and we're able to pick the topics that interest us. Now, what can clinical directors and small business owners do to be more inclusive? So if you own a small business, you have the biggest responsibility to be inclusive because you're able to change everything in the clinic. You can change the intake forms, the posters on the walls, and you can mandate staff training. So it's up to you to set a tone of inclusion in your clinic. That looks like putting gender, sex, legal name, preferred name, and pronouns right on your intake form, because right from the get-go, people have an understanding that you're inclusive. Inclusive and accessible washrooms should be available whenever possible. I know this one is a little bit more challenging. My clinic doesn't even have inclusive washrooms. Unfortunately, we have a men's and a women's washroom, and that's all we have on the floor. Brochures and educational materials and posters should be inclusive. You can add pronouns to your staff bios, and you can ensure that all healthcare providers in your clinic are knowledgeable about LGBTQ+ healthcare. You can also ensure that hiring and HR policies are inclusive. So what does this look like? This looks like we are an equal opportunity employer. Our company has strong policies on workplace harassment and inclusion. Display posters that represent the LGBTQIA2S+ community. If you're a fertility clinic and you advertise that you do LGBT fertility care, I expect to see that represented in your brochures, in your posters, and on your website. And then, of course, having an inclusive and accessible washroom. My talk today has really focused on barriers and opportunities to remove them. As an ally, I'm looking for ways to support other allies so that we can do the best job for the LGBTQ+ community. But I need to point out the strength of the LGBTQIA2S+ community. Their self-advocacy and visibility has the biggest impact. So here are a few ways that I've seen LGBTQ+ folks advocate for themselves. They introduce themselves with names and pronouns. They correct people who dead name them. They point out offensive and outdated language and recommend better word choices when it's appropriate and safe. When they seek healthcare, they tell healthcare providers their SOGI if it's relevant. They stand up for themselves and they do not let healthcare providers brush off their concerns. They learn about health disparities and ask for additional supports when appropriate. They educate healthcare providers who aren't familiar with LGBTQIA2S+ healthcare, and they find providers who know how to support them. I used a bunch of resources for my talk today and for my own general learning. Here are the two that I recommend for light reading. The first is the SOGI Safer Places Toolkit from Alberta Health Services. While I'm not associated with Alberta Health Services in any way, shape, or form, they are the biggest healthcare provider here in Alberta, and they put together a wonderful resource on how healthcare providers and communities can be more inclusive. EAGLE is also the other one I recommend. They're Canada's leading organization for 2S LGBTQI people and issues. Their website has so many resources. I couldn't list them all here, so I just put the main site.